Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in First Medicine, and today we'll continue with about infanticide. In this, we'll discuss about cause of death in case of live birth. Causes of death can be divided into natural causes, unnatural causes, and criminal causes. Again, natural causes there is disease of mother. Unnatural causes mainly includes causes related during birth and after birth, and criminal causes mainly include act of commission and act of omission. Coming to one by one, natural causes mainly divided into causes related to mother and related to newborn. Related to mother includes like intrapartum asphyxia, that is during a type of birth there may be asphyxia. There may be some AB or blood group RH incompatible between the child and infant and the mother. Early separation of placenta because of some injury or some other reason may be there. Preeclamptic toxemia, that is increased blood hypertension in mother, or sudden infant death syndrome, which is one of the cause of death in live birth. Then causes related to newborn like prematurity, premature child, or birth trauma, any form of birth trauma may be there. Neonatal infection, some type of infection in the child before delivery only. Then post maturity, then congenital malformation in children may be one of the natural causes of live birth. Related to unnatural causes, which may be divided into perinatal and postnatal, that is during birth and before birth and during birth. Before birth, maybe because of injury to some mother, so there may be some injury met with the accident met with the mothers, which may lead to premature separation of placenta or injury to the fetus, which may lead to concussion of brain, fracture, rupture of blood vessels, leading to death of the baby. Then there may be prolonged labor, where the duration of labor may prolong for many hours to days, which may cause death of the fetus due to injury to the brain because of because of asphyxia. The child may be suffocated in the birth canal itself and lead to death. Then prolapsed cord or pressure on the cord, so it may be caused because of stoppage of fetus circulation during birth, and death of the newborn may be occurred during the or just after the birth. The cord may be compressed by any reason, or prolapsed, or pressure may be there, which may lead to death. Then twisting of the cord around the neck or knots on the cord, it can cause death of the fetus during birth or immediately after birth because of asphyxia and strangulation. Then one more reason may be because of death of mother. Death of the mother may be because of any reason like accidental death or intentional homicidal death may be present, which may cause the death of the infant leading to live birth. Postnatal, that is after immediately after the delivery, the causes which may cause death of the infant, which includes like suffocation, which may be due to non-availability of nursing care. The unit may not be cared, and the air passage may not be clear, which may lead to smothering or choking due to inhalation of amniotic fluid or blood immediately after birth. There may be cause of precipitate labor. This is one of the major cause where all the three stages of labor occur very in quick succession, so that the delivery occurs suddenly, which is seen in multipara. In this condition, the woman is not even aware that she is in labor. She may just go to the some lavatory or some for passage of stools, and there may be delivery may occur. So in this case, the woman may not itself know that she is in labor, and she may lead to birth of the child. It may cause the death immediately because the child may be head injury may be present, because the child may suddenly uh, it may be delivered while standing, and it may hit on the ground leading to death, or it may be drowned or suffocated in the any water type of water, or from bleeding from torn end of attached umbilical cord may also lead to death during precipitate labor. The precipitate labor is one of the has a medical legal aspect where death of the newborn due to precipitate labor may be taken as a case of deliberate infanticide. So if in case of precipitate labor, the mother itself may be considered the culprit, may be thought to be culprit, but even though it is it is a natural cause, but the family members of the woman or the husband may think that she has killed the child. Infanticide, deliberate infanticide may think to be infanticide, but even though it is a precipitate labor. The mother may sometimes claim infanticide in case of or negligence on the part of the doctor when in these situations, but death of newborn is because of a prostate labor. Now coming to criminal causes of live birth, it may be divided into act of commission and act of omission. So act of commissions are acts done positively to cause death of an infant. So the person has the intention to cause death of the infant by doing certain acts, which may include like strangulation by ligature materials. So commonly they may use the umbilical cord itself to cause strangulation, or may also cause throttling using the hand. Poisoning cases, the commonly they used to use opium. The next they can use also is as acids or insecticides, which are commonly available poisons are used. Then smothering the baby by use of help of a hand or clothes. Head injury by lifting the infant via the legs, and the child may be hit on the ground or the wall. Then concealed puncture wounds, which may puncture through the concealed parts of the child, mainly includes like a frontalis, nape of the neck, or inner canthus of the eye. Any puncture wound may cause the rupture of the blood vessels, may lead to death. Then twisting the neck by any means, which may cause rupture of the spinal cord. Then burning the newborn or disposing the live bone inside the woman. Drowning, which may also serve the purpose of disposal of unwanted child, or cutthroat injury, are the acts of many ways where the positively they want to kill the child by act of commissions. Then act of omission or neglect, there is intentionally failure on the part of the mother or to extend the care of the newborn, leading to its death. This may amount to infanticide. So here the intentionally failure of the mother to take care of the child may be present. So it may lead to death of the infant. So they may be divided like proper assistance may not be proper assistance may not be taken during their labor. Air passage may not be cleared or obstructed by amniotic fluid or mucus. Umbilical cord may not be tied or cut after the delivery. The child is not protected from exposure to heat or cold, or child is not provided food. So these are the act of omission where the child is not properly cared enough, which may lead to death of the child, leading to live birth. Coming to medical aspects of live birth, abandoning of infant, that is, if the child infant is been abandoned in any remote areas, which is comes under 93 of Bharatiya Nyaya Samhita. If the child is found alive, there is 7 years of imprisonment. If the child is a girl child, it is then the punishment is up to 10 years and fine. Then concealment of birth by any means, where the woman may conceal her birth by delivering some place and conceal the child. So it comes to 94 of Bharatiya Samhita. If the child is dead, it becomes 2 years of punishment. With the girl child, it is 5 years of punishment fine. Next is Bader-Babi syndrome. This is the syndrome which where the child is being beaten by the parents itself. It is also known as CAFE syndrome, child abuse syndrome, Martyr syndrome, or the accident death syndrome, where the child is physically beaten for and the child may die because of that. Now coming to SIDS, sudden death infant syndrome. This is one of the unknown cause of live birth, but even though it is incidence is less, but it is a condition where even after doing in thorough investigation, the cause of the child death of the child live child infant is not known. So it is also a different names like cord death, crib death, and it is defined as sudden unexpected death of a seemingly healthy infant whose death remains unexplained even after thorough case investigation, death scene examination, review of clinical history, and complete autopsy. So this is a condition where the child is healthy enough and suddenly it dies unexplainably, and even after doing thorough case investigation, death scene analysis, review of clinical autopsy, clinical history, and doing thorough autopsy also, the cause of death is not. Fairly, its incidence is 0.2 to 0.4% of all live births. It is present in all over the world, mainly seen between the 2 weeks to 2 years, mainly in the mid infancy. It is seen. Prominent male infants are more prominently compared to female. Low socioeconomic causes, it is seen in morely in low socioeconomic conditions than higher socioeconomic conditions. Most commonly seen in cases where the early morning deaths are commonly seen, which indicates that child may have died during night, or after within first feed in the morning the child dies. It is also seen commonly in twins, which may be because of prematurity or low birth weight in the other twin. Maybe there. In addicted mothers, like the woman, if the mother is addicted to smoking or drinking or drug abuse, it is commonly seen. And if the child is premature, also it increases the higher risk of sudden infant death syndrome. Cause mainly, it is definitely different cause is not known. Common, there are many theories. One common is the sleep apnea. So it is accepted as the most common suggested cause. In this, there is a periodic failure to breathe during sleep makes them susceptible to hypoxia. So during sleep, The child usually suddenly stops breathing. There is a chance of decrease in sleep breathing, which lead to hypoxia, which may hypostate may extend enough that the child may die. This hypostate may be promoted more by in some infectious conditions like of respiratory tract. Certain respiratory infection may cause viremia, which leads to sleep deprivation of respiratory symptoms, which lead to death. Other theory includes nasal edema, mucous secretions, may narrow upper respiratory tract passages, or flaccid pharynx neck posture may reduce the airway, which may also is one of the theories of SIDS. Then bed cloths and pillow falling accidentally over the mouth may also may restrict the movement of the child. Overlaying. Overlaying is one of the asphyxial death or posterior asphyxia where the mother itself may fall over the child, leading to enable the movement of the where the baby is unable to breathe properly, leading to asphyxial death. Is mainly seen in intoxicated mothers. Then Artaud-Berger syndromes. Here it is a very rare cause where the child may convert the enzymatic content in the stomach may convert the milk into alcohol, resulting in alcoholic poisoning. Other causes like conduction system anomalies, hypoparathyroidism, deficiency of selenium, antibodies, calcium, magnesium deficiency, vitamin B, C, D deficiency, house allergy, sodium overload, and hyponatremia are other causes. Postmortem findings, there is not definite finding. All of the findings are negative. There may some trachea may contains milky vomit, sometimes blood stained with shed with epithelial cells. Multiple petechial hemorrhages are commonly seen in most of the autopsy conducted in during SIDS. Petechial hemorrhages are seen in heart, lungs, and thymus, which indicates that the child was agonal, means it was suffered because of asphyxia, and these petechial hemorrhages occurs. Pulmonary edema is also common. Milk blood stains forth and on the child's mouth and on bedding may be present. Hands are often clenched, fibrous and closed, which indicate the child may be suffered during the death. In 50% of cases, some pathologic conditions may be found, such as pneumonia, congenital heart disease, Down syndrome, or tracheobronchitis is seen. SIDS is a natural death in which parents may be wrongfully linked for having criminal involvement or negligence. So sometimes when a child is dead because of SIDS, the the parents may be accused of negligence or having causing infanticide and may be arrested. Some infanticide cases may also be presented, may also be treated as caught death cases and may be also be released. These are my references. Thank you.